As a new mother, it's completely natural to feel a wave of concern when you're feeling unwell, worried you might pass a cold, the flu, or even a mild stomach bug to your precious baby. Many breastfeeding moms share this exact worry. Here's the reassuring truth. Breastfeeding remains the safest and most beneficial choice for your baby, even when you're under the weather. In fact, by the time you notice symptoms, your baby has likely already been exposed to those germs. That's where your breast milk's powerful antibodies step in, acting as your baby's best line of defense during this vulnerable time. It's important to know that common respiratory viruses, like colds and the flu, don't usually pass through breast milk. They spread mainly through tiny droplets released when you cough or sneeze. To reduce the risk of passing it on, wash your hands often and thoroughly with soap and water. Turn your head away when you cough or sneeze. Continue nursing your baby as usual. Wearing a mask while breastfeeding is completely optional. It's up to your comfort level and the type of illness. But the most crucial step is to keep breastfeeding. That's what truly protects your baby's health. When it comes to stomach bugs, your main focus should be staying hydrated. Dehydration poses the biggest risk because it can lower your milk supply. Fortunately, the viruses that cause stomach bugs almost never pass directly into breast milk. So, you can safely keep feeding your baby, even if you're dealing with one. Drink plenty of water, sip clear broths, or use oral rehydration solutions throughout the day to restore lost fluids and keep your supply steady. For nearly all everyday illnesses, remember this: your breast milk is a shield against infection, not a source of infection. Trust your body's incredible wisdom. It instinctively knows how to protect your baby when they need it most. By continuing to breastfeed, you're not just nourishing your baby with vital nutrients, you're also delivering a tailor-made blend of antibodies and immune factors designed to actively defend them. Mastitis, while painful, is another situation where keeping the milk flowing is key. Nursing frequently, especially from the affected breast, helps clear blockages and speeds up healing. The milk remains safe for your baby and even contains extra antibodies during this time. If the pain is too intense, start feeding from the other side and switch over once your milk is flowing. Most antibiotics prescribed for mastitis are safe to take while breastfeeding. Your doctor will select the right one for you, and it's important to finish the full course, even if you start feeling better. Only in rare cases, such as certain severe infections or treatments, would stopping breastfeeding be necessary, and that decision would always come under medical guidance. For almost every common infection, including mastitis, the advice is simple and clear: keep breastfeeding. It's the best thing you can do for your baby and your own recovery. Motherhood often feels like a roller coaster, filled with breathtaking highs and challenging lows. When you're feeling sick, those lows can feel even heavier. But here's a powerful truth worth holding on to. Breastfeeding while sick isn't just safe. It's one of the greatest acts of love and protection you can give your baby. In fact, during times of illness, breastfeeding becomes one of the best ways to safeguard your little one's health and well-being. That's because breast milk is far more than just food. It's a living, dynamic fluid that continuously adapts to your body's changes and your baby's evolving needs. It's personalized medicine, designed uniquely for your child. When you're fighting off an illness, whether it's a common cold or something else, your body immediately gets to work, producing infection-fighting antibodies. And here's the amazing part: those very antibodies pass directly to your baby through your breast milk, giving them instant, targeted protection. Every time you breastfeed while sick, you're essentially handing your baby a custom-made immune boost, perfectly tailored to the threats you're both facing. Decades of research show that in over 95% of cases, continuing to breastfeed during common illnesses is not just safe, it's the absolute best decision for your baby's health. Germs like cold and flu viruses generally don't transmit through breast milk. Instead of spreading illness, your milk delivers protection, arming your baby with the natural defenses they need. Beyond its powerful immune benefits, breastfeeding also provides comfort, security, and perfectly digestible nutrition, which is especially valuable when you and your little one are both feeling unwell or run down. Think of your body's response as a superpower, an intuitive, natural ability to protect your baby. With every feeding, you're crafting a unique, personalized medicine specifically designed for your child. By continuing to breastfeed, you're actively lowering your baby's risk of catching the illness you're fighting. And even if they do get sick, your milk helps them recover faster and more effectively. Remember, you're not just nourishing your baby. You're fortifying and strengthening their developing immune system with every drop of milk you give them. Let's look at some practical ways to manage breastfeeding when you're not feeling your best. First, know this: you're doing an amazing job, Mama. You are already giving your baby exactly what they need. You are more than enough. If you need medication while sick, the good news is that most common over-the-counter medicines are safe during breastfeeding. Pain or fever, acetaminophen and ibuprofen are top choices. Allergies, loratadine and cetirizine are considered safe. Cough, dextromethorphan is generally fine when taken at the lowest effective dose. Antibiotics, most, including amoxicillin and cephalexin, are safe while nursing. Always double-check with your doctor or pharmacist before starting any new medicine to ensure it's right for you and your baby. When choosing medications, there are a few to avoid while breastfeeding. Decongestants with pseudoephedrine, these can lower your milk supply. Older antihistamines like diphenhydramine, they can make you drowsy. Aspirin and codeine-based medicines, not recommended during breastfeeding. High-dose supplements and most herbal remedies, best skipped for safety. Here's the key: take care of yourself so you can care for your baby. Stick with safe medications, rest as much as possible, and most importantly, keep breastfeeding. Your health matters just as much as your baby's. Illness, fatigue, and dehydration can sometimes cause a temporary dip in milk supply, but it's almost always short-lived. Keep nursing frequently. Your body makes milk based on demand. Aim for 8 to 12 feeds within 24 hours, and hydrate well by drinking water, broths, or electrolyte drinks until your urine is pale yellow. Rest is essential for recovery. Ask for help when you can. Let go of non-urgent tasks, and try side-lying breastfeeding to nurse while resting. Knowing them early can prevent complications and ensure timely treatment. Call your doctor if you experience a high fever over 103 degrees Fahrenheit could indicate a serious infection needing prompt care. Inability to keep fluids down, risk of dehydration that can impact your health and milk supply. Severe dehydration signs include dizziness, very little urine, or extreme thirst. Chest pain or difficulty breathing may signal serious respiratory or cardiac issues. For mastitis, red streaks spreading from the affected breast, or symptoms that worsen even after antibiotics, this could mean a resistant infection or another underlying issue. For your baby, seek immediate medical help if you notice any fever in an infant under 3 months. A rectal temperature of 100.4 degrees Fahrenheit or higher is an emergency. Signs of dehydration: fewer than 6 wet diapers in 24 hours, a dry mouth, no tears when crying, or a sunken soft spot on their head. Excessive sleepiness or lethargy, hard to wake or unusually inactive. Refusing feeds, showing little or no interest in breastfeeding or bottle feeding. Breathing troubles, rapid breathing, wheezing, or struggling to breathe. These symptoms can escalate quickly and need prompt medical intervention. Trust your instincts. You know your baby better than anyone. If something doesn't feel right, don't hesitate to reach out to a healthcare professional. These guidelines aren't meant to cause worry. They're here to empower you with knowledge, so you can confidently protect both yourself and your little one. Act with confidence when care is needed. Advocate for yourself and your baby, and don't be afraid to ask questions or seek a second opinion if you have concerns. Always remember, your body is designed to protect and nourish your baby. even when you're sick. Breastfeeding provides unmatched immune protection, comfort, and nourishment. The closeness you share with your baby is just as vital as the antibodies in your milk. Care for yourself with the same tenderness you give your baby. Hydrate, eat simple meals, rest deeply, and accept help without hesitation. Self-care isn't selfish, it's essential. Trust your body and the powerful bond you share with your child. You are exactly the parent your baby needs. Even on hard days, you're doing an incredible job. Your milk is both a gift and a shield. You are enough, always.